Maybe it's useful, maybe it's not, but we like to share those slides and our contact information with everyone because we'd like to continue this conversation however you see fit, or if you ever want to reach out to us for, just ideas or ideation, we'd love that for sure. We're a new organization, the Center for Rural Engagement. We've been around for about 2 years. Our university's been around for about 200. And so this is new in some ways at a university level. But with that, what I'd like to do is just go around and do quick introductions of our team, and then I'll pull up the slides and we'll get started. And so I'm Todd Burkhart. I'm at Indiana University. I'm the Director of Campus Partnerships for the Center for Rural Engagement. Catherine?
Yes, my name's Catherine Pope. I'm the Health Liaison at the IU Center for Rural Engagement, and I just want to let you know that this conversation is being recorded. I hope that's okay.
I'm Jane Rogan. I'm the director of an initiative called Sustaining Hoosier Communities. The word Hoosier is the descriptor for people from the state of Indiana, for those of you who might not know, because it's quite a colloquial little term. The initiative that I run is a course-based initiative, and we follow the asset-based community development model.
Whitney Schlegel.
And I'm Whitney Schlegel. I'm a faculty member in the Department of Biology, and I also work with the center as a director of faculty engagement and leadership.
Okay, and last but definitely not least, Jeannie Johnson.
I'm Jeannie Johnston. I'm a faculty member in the School of Public Health, and I've been working with the Center for Rural Engagement for about 3 years.
Fantastic. Okay, so now what I'd like to do, if I can make it happen, is share my screen. Okay, so everybody can see slides are up, right? Good to go?
Yes.
Okay, all right, fantastic. I'm the most technologically challenged of the group, and so they figured this was the best way to have me do it to, further development.
Baptism by fire, my friend.
That's what they say. And so, hey, again, really appreciate the opportunity to be here today. And so we're going to be talking to you regarding the Uplands Physical Activity Network, and this is our agenda for today. And so what I would like to do is spend a little bit of time talking about the Center for Rural Engagement, kind of give you a little bit of the background before we get into the project that we're currently one of the projects that we're currently working on. And so, as I mentioned, the Center for Rural Engagement has been around for 2 years. It was really the initiative of our provost, Lauren Rebell, and other campus stakeholders with the support from the Lilly Endowment, which is a private philanthropic foundation for supporting community development and engagement. And so we're working with really rural communities right outside of our gate. Of course, just like any college or university, we have a long-standing tradition of community service, but really that's been at the individual or group or maybe even unit or school level. But this is the first time our university has a center at the university level where we work in tandem and across all schools. We have 12 schools within the university itself. And so really, as probably is in a lot of countries, rural communities have been a lot of ways devastated in a lot of different ways over the last few decades, with people leaving, lack of jobs, lack of educational attainment, lower pay, not improvement in housing and quality of place. And so this is an effort, a concerted effort at the university level to try to help regarding, providing opportunities and also trying to mitigate problems. And so I should have mentioned, we do this through a series of different things, whether that's engaged teaching, applied research, or community impact proposals. Applied research can run the gamut from community-placed or community-based, or also community participatory-based research. We have several different projects, I think up to about 50 or so, that are in 3 different focus areas that I'll talk about here in the next slide. And so 3 focus areas that we're currently working on and we have been in the last 2 years: health, physical, mental, and social well-being. Community resilience is really food and water access, quality, and security, and also the stewardship of natural recreational assets, and quality of place, art and culture, and also the built environment. We hope in the out years or in perpetuity when the center continues that we'll be able to focus on additional 3 areas of educational attainment, economic development, and leadership development. And so I thought maybe it was important just because of the group and being an international audience. And even if you're in the United States, maybe you're not really familiar with Indiana, I thought it'd be a good idea just to spend a couple minutes just kind of explain where we're at. And so as you can see, the map on the left is the United States. And so the state that's highlighted there is Indiana. And so just to show kind of a closer picture itself, we're this area that we work out of, it's an 11 county region. It's known as the Uplands region. Now we expand our work outside this region that's dotted in yellow line, but we do comprehensive, right? Our health, community resilience, and quality of place initiatives and programs in that 11 county region. The red dot itself shows really where Bloomington is, and where Bloomington is, that is really, that's Indiana University is located there as well, the school that we represent. And so the topography for this area, it's different than most of Indiana. It's more complex and varied than other regions, has large swaths of forest, marshes, rolling fields, several chains of low mountains, and so gets the term the uplands, and also high hills and sharp valleys. And so thought it was important to talk a little bit more about the demographics, try to give you some atmospherics about the region itself, the people that are there. And so population is a little over 400,000 with 180,000 dwellings. And you can look see there on the left, the size of the largest cities. By far, Bloomington, the college town that we work at, is much larger than any other town. The other ones are the next 7 by size. And also you can look at trends. Probably is the case in a lot of rural places across the United States and probably across the globe, where we tend to be older, to make less money, less opportunities to attend college. More people live in less urbanized areas, and also significantly less access to broadband or high-speed internet connection. A misnomer a little bit is with the 400,000 people, over a third of it is in Monroe County, which is the county where our Indiana University is located. I think some ways that county itself kind of skews some of this data, because it would be much higher regarding lack of access to broadband, also much older, also less urbanized area. And you can just see some of the commercial farming and the industry in this area as well. And talking about demographics, overwhelmingly, I think it's like 93% are white in this region. Again, if you take out Indiana University, which is an incredibly diverse population with international students as well, I think a lot of the rural areas that we work in is probably 97 or 98% white. And so a little bit about the university itself, about 45,000 students, over 2,000 academic staff, and there's 12 schools. So it's a huge amount of different resources that now Indiana University, through the Center of Rural Engagement, is trying to orchestrate and organize different initiatives and projects and proposals across multiple schools. And so last slide for me is something I think we all recognize in the center, being 2 years old and going through maturation processes, is that institutionalizing models is fundamentally important to what we do. And so Jane is going to talk about, of course, that's what this conference is about: asset-based community development, equity of voice, seat at the table, building on, appreciative inquiry. I think this is fundamental to what we do and what we're about, to making collaborative projects and developing really partnerships. Also, strategic doing is another framework that I think Jane's going to talk a little bit about. Again, it's a way to tackle complex problems. Sometimes the complexity of problems stymies people's ability to get around a table and work through something. And this is really an easy approach in order to work on Pathfinder projects in order to, to get the ball moving, so to speak. Other things that we do within the center is we facilitate colloquiums and poster sessions as a way to educate, inform, and inspire staff, faculty, students, and community partners. I think one of the key benefits of this is the ability then to network and to work across different schools. And what we see is transdisciplinary approaches to the complexities that are in rural communities. And the last thing I would mention is we're currently working on a rural competency certificate because we understand the importance of developing genuine and true relationships in rural communities using, not understanding, having knowledge, skills, and attitudes. And so we think everyone who works in communities, we represent Indiana University in the center, and there's probably a long history of faculty who have gone into community and they were self-interested. And that can be detrimental to our work. And so we think it's important to develop a system where there's a baseline of understanding for everybody through our center that works in rural communities. And so with that, I'd like to turn over the next piece of the talk to Catherine Pope, who is going to talk about our goal, health area focus.
Hi, so I'm Catherine Pope again, and I'm a registered nurse and have a background in public health. So at the center, my focus is really health. And I apologize, I have children in the background who are slightly so I just want to talk about, when I joined the center, I really wanted to understand the health issues that we were facing in the Indiana Uplands region. So it represents a wide variety of health, and we can determine kind of where our health is by looking at county health rankings. So if you're not familiar with the United States, we have the country, then it's broken up into states, and the states are broken up into counties. And we have 92 counties here in Indiana, and every year we get rankings, how we compare to the rest of the state. So with the counties in our Indiana Uplands region, there's a wide variety. The best counties rank 12th in health outcomes, and the worst rank 82nd in health outcomes. So obviously a wide range. Health outcomes are going to be things like length of life or low birth rate. We can also look at health factors, which is an even broader range, and health factors are going to be things like smoking, whether or not you have insurance, whether or not you exercise. The best county in the Indiana Uplands ranks 4th in the state for health factors, and the worst county in the Indiana Uplands is actually dead last. It ranks 92 out of 92 counties. So you can see that even though we're all in the same region, residents in each county are struggling with a wide variety of health outcomes despite being neighbors. And we struggle to identify why that is, since our demographics often have more similarities than differences. Not surprisingly, income does play a role in this, and there is definitely a correlation between higher income and better health outcomes and lower income and worse health outcomes. Todd, if you want to go to the next slide. So it's tempting to only look at demographics and statistics to understand a region's health needs. Todd, if you want to flip to the next slide. I think you're in charge of the slide deck. I'll keep going on. There we go. Thank you. But we wanted to see how the residents themselves thought about health in their communities, not just what the stats are, but what do residents say are their biggest issues. And so in the United States, hospitals have to perform a community health needs assessment every 3 years. This is mandated by the government if they want to get any federal funding. And so a community health needs assessment is when that area gets together, they identify local experts, they survey residents and try to figure out what community members are identifying as their biggest health needs. So at the center, we took a look at those community health needs assessments in our specific area to see what residents thought were important. And in the uplands, as you can see in this picture, it was chronic disease, and chronic disease is going to be diabetes, obesity, and substance use. Residents also ranked access to care as a large issue. Access to care can be defined as lack of insurance or simply the lack of transportation to go to the doctor, to go to the hospital. This can often be a bigger issue in rural areas. Social determinants of health were also a top priority, things like income or education. And this was different from the rest of rural Indiana, which ranked mental health as a top issue, but not social determinants of health. Chronic disease and substance abuse were still in the top 3. So when we did this analysis, we were really able to give communities a voice in identifying their greatest needs, allowing them to tackle the issues that were most pertinent to them. So Todd, if you want to go to the next slide, please. But of course, we're doing ABCD. We're looking at assets. So we didn't want to just look at health needs. We wanted to look at the assets as well. And there are a lot of assets. We can first look at them on a macro scale and then zoom in. So there are a lot of health infrastructures in place that are considered assets. Some are federal, like Medicare, so insurance for people over 60. Some are run by the state of Indiana. This is going to be Medicaid insurance covering people with disabilities. And then there are system of care coordinators. These are state employees who are focused in a regional setting who aim to address behavioral and mental health issues. Some are created by organizations themselves. Purdue University, another university in our state, has nutrition and health experts in every single county in the state. They're called community wellness coordinators. There are also regional assets to this area. At the Center for Rural Engagement, we like to consider ourselves a regional asset, but there are other organizations that can fund or facilitate projects. We live in a beautiful area as well, and so there are a lot of opportunities to get outside, to walk. Having just moved here from the desert, it's much easier to garden here. And so that's a positive. And then we drill deeper. Each county has their specific assets as well. And these can include local hospitals, health departments, grocery stores, individuals, community volunteers, much like your communities as well. And of course, our greatest asset, which is I'm sure the same for all of us, is our people. Community members are the largest asset with their strengths, their passion, their ownership, and their collaboration that they demonstrate in such a wide variety of ways. The project that we're going to discuss, and I'm jumping ahead just a little bit, takes place in Washington County. Jane is going to talk about that project itself and why it's in Washington County. What's that? Oh, so sorry. We were working in Washington County, and Jane had done a lot of great research, work on helping community members identify their assets. And so you can see in this word cloud, these are actually just the health and wellness assets that the community identified themselves. They listed hundreds of different ones. And so now that we know what the community identifies as their own assets, we can make sure that we're using those as we move forward. Next slide. So speaking of Washington County and which is where we're going to work, I want to briefly discuss why this is the community where we're going to be. And Jane will go into this more, but she's successfully created an ABCD model called Sustaining Hoosier Communities. So when I knew that the county for Sustaining Hoosier Communities was Washington County, I wanted to get to work and understand what was going on. So I joined their health action team. It was formed in 2016. So I wanted to learn what they were doing, what their initiatives were, what they were currently working on. One of their current initiatives is to reduce childhood obesity. And they've spent a lot of time working on built environment projects as well, sidewalks, trails, things like that. So I've been joining them once a month to kind of learn what they need and to listen and serve as a resource, but really trying, of course, to step back and let them take the lead. So when Whitney and Jeannie, who will then be presenting later, approached the center with a proposal for a physical activity network, I really was excited about how well it aligned with what Washington County was doing. And so working with this group would allow us to launch an initiative in one county and then hopefully expand. I also knew that this would work because Whitney and Jeannie have a really great history of asset-based community development in Mitchell. My one-year-old agrees with that. And so they'll be talking about their previous experience too, which has really set them up for this project that we're doing in Washington County. But of course, I want Jane to explain why we're working in Washington County and the background of that project. So if no one has any questions, I will pass it along to Jane.
Thanks, Catherine. Thanks, Todd. Hi, Jane Rogan, and as Catherine said, I run the Sustaining Hoosier Communities Initiative. And one of the things that we did when we started Sustaining Hoosier Communities was we joined the EPIC network. And if you're not familiar with it, it's an international consortium of universities who will follow the same model. And EPIC stands for Educational Partnerships for Innovation in Communities Network. And you can imagine, because it's such a long title, that's why they call it EPIC. But the EPIC program basically exists to draw on the strengths of a university and to utilize them alongside a community for a duration of no less than a year, and to use the strengths of the university, which would include its faculty, its research, and its students, to solve problems that the community itself has come up with. And so just to give you a timeline here, we actually teach for an entire academic year within a community, so where students are responding to projects and working on projects in their coursework that actually are owned by the community itself. But it takes a lot longer ahead of and at the end of that year to sort of get everything up and running. So some 9 months before we actually start teaching, you can see here that the October year 1 is when communities are applying, and we're not done teaching until May of year 2, and then we start actually working on continuation projects. So we end up being in a community for at least 2 years, and we feel this is really important to set up the kind of robust relationships that we want to develop with communities, and it really does allow for some sustainable futures with our communities. We've built enough trust that folks really do want to reach out to us. So an example of that is the very first community that we worked with, which has now been over 4 years ago, came back to us relatively recently and asked us to help them with a grant proposal that came out of the work that one of our students, one of our classes had done in the community regarding a retired fish hatchery that the state Department of Recreation wanted to deed back to the community. They didn't want to manage it anymore. And we helped them write the grant, which was based on the student work. And they secured the grant for a quality of place initiative to make improvements to the site and make it actually be a recreation destination in the community, as opposed to its current role, which is basically an abandoned facility. So, you know, the way that we can create these long-term relationships really kind of helps us over time, really kind of with this idea that we will keep returning to these communities, maybe not to do an in-depth teaching operation, but really just to keep returning to them to offer whatever they need, whatever kind of assistance we can grant. And to give you a sense of the scale, every year we have somewhere between 450 and 700 students who are involved in the work in each community. And that can be anywhere between sort of 15 and 30 classes, individual classes that are participating in community project development. It's really important for us to know, Todd, can you switch on to the next slide, please? It's really important for us to note that we truly put this particular model of citizen participation from Arnstein. I mean, I can't believe she wrote this back in 1969, and it does seem like with what's going on in the world today, it just becomes more and more important for us to keep recognizing the centrality of this model to our work. But the idea is to put the community first. And I think universities in particular, when they do community engagement work, have probably had a bit of a bum rap over the years for maybe not doing this. And I think some of the skepticism that comes from communities working with communities is probably well earned on the part of the universities. You have brilliant minds, and they want to do good, and I think they're not necessarily used to listening before talking. And so using this model to recognize that we want to at least engage our communities at that partnership level towards the top of the model, that's the minimum way in which we want to engage with our communities. Anything less than that, we're not interested in. And so when we work with faculty, and Jeannie and Whitney are testament to this, Jeannie and Whitney don't come to us with an idea of what they want to do. I go to them with an idea of what the community's told us that they're looking for. And they find a way to fit that project into classes that they're already going to be teaching in the upcoming academic year. And that is really central to what we're working on here. We really want to make sure that anything that we work on in a community can be self-sustaining after the fact, and that the deliverables that Jeannie and Whitney would create don't actually rely on assets that are held externally to the community. And if we need to do some training or education or build up some strength within the community, then that has to be part of the project as well. Todd, can you flip up? So next up for us is asset mapping. And so obviously, as we started our community work, we were kind of finding our way at first. And I wanted to start making sure that we were doing a decent job with mapping what's available in our communities. And I had looked at some of the traditional asset mapping models that are out there. So the sustainable livelihoods model, which is, I think, frequently used in asset-based community development, like what are the human, financial, natural, physical, and social assets that exist in the community, and kind of trying to map those. And I also looked at the flora and flora model of community capitals, and that basically takes the sustainable livelihoods model and adds to it cultural and political as two additional segments. And what I found with this was I really wanted to do this work not as an observer of the community, but I wanted to put this mapping process in the hands of our community members and have them tell us what they think their assets are, which is fundamentally different than what we might observe as assets, right? Just because we think something is an asset doesn't mean to say that the community member holds the same belief. So we wanted to do this in a way that really kind of got to that native knowledge, if you will, sort of really reaching out to the community and having them teach us about their own community. And the more I dug into some of these models, the more I found it difficult to explain to people what some of those categories meant. So we spent a lot of time really reflecting on the work that we do in our communities and the types of interactions we have, not just with community members, but with different assets in the community. And instead of using the existing models and their category names, we built our own model and we developed our own category names that would be more relevant to our community partners. And so it creates, what's really important for us too, is that it creates a common language. So instead of our faculty relying on their sort of academic speak and like thinking about their academic silos as how they define their work, they're now defining their work in terms of these asset categories that are really broadly understood by both the community partner and the faculty member. And I think this helps to equalize a little bit some of that sort of visible, or maybe it's not visible, but that tension between the sort of power structure of like the large university and, oh, I'm just a community member, it equalizes everything because everybody's using the same language. So we did have a question for you, and I just wondered, Todd, you can flip over to the next slide there, because it shows you what our asset categories are on our asset map. But I wondered if you wanted to maybe pop some comments in the chat box, and Catherine, so I think, has already put that question in there. But do you have any sort of favorite models that you use for asset mapping that you might want to clue us into as well? So I'm having a hard time seeing all the things on my screen. So great. Okay, Jane, awesome. Yes,
or Jane, I was going to say, if anybody would just like to chime in, just unmute your mic and just talk about a particular model. Feel free to do that as well.
Jane D said, for me, it depends on your purpose and intent on how you asset map. We also use blended models and create a bespoke type of mapping based on the co-creation of community members.
Yeah, so I think our asset map that you can see on the screen there with its 10 categories was sort of, I think to Dee's point, it sort of became a creation out of our experience and also of what we do in the center, but then also our experience in communities of the kinds of ways in which we've been working, and what our community members kind of found in some ways palatable for the ways that we can describe their community. I think it's really important to make sure that your language reflects the language that communities themselves utilize. So I think, this is a good point from Dee there. Todd, you want to flip on to the next slide here? So when we do our asset mapping, we do that work in large community meetings, and the community meetings are called by our community coordinating committee. Todd, where are we? Okay, there you are. I lost you on my computer, Todd. Sorry about that. So in order to kind of keep the conversation flowing, both with our faculty members and with our community partners, what we did this year was we took all of the assets that community members had listed, and we also then get them to think about projects that they would like for us to work on in their community. And we kind of make sure that when they're working on those when they're coming up with project ideas, we really do ask for them to to make sure that the project idea is building on an asset that they have mentioned on their asset sheet. So we hold community meetings, we give out 2 sheets of paper. One is an asset map, and one is a 2-sided project request form. And, you know, on the project request form, it says, you know, what is your idea for a project? And it's like, well, what asset does this build on? And why is this asset important to you? So this really gives us a lot more information about those assets, and we can see what they are, and we can visualize them, and we can go out and visit them in the communities. But we want to understand why those assets are important and why they're central to the work of, you know, to what's going on in the community, and how community members really think that working with that asset might improve things in their community. What are the things that they're looking to ameliorate? And so an example for that might be that community members will often, when we say to them, well, what's a good project? And if we don't have them using that asset framework, we might say, what's a good problem? What's a good project for us? And what they'll give us back is, oh, well, kids don't have anything to do. Okay, so what do you want? Well, we need to have something for kids to do. Well, what does that look like? You know, who is in the community? So, you know, we're constantly probing, but we found that if we say to them, like, what's an asset that you value that you think we could build on? They'll say, you know, there's a park here that nobody uses and kids don't have anything to do. If we made the park more suitable for teenagers, we think that we could create a safe space for us, for our kids, and we think the families would go, and we think that. So just reframing the conversation to be projects about assets really helps us out. So in order to keep that conversation flowing, we created a story map this year, and this was our first foray into doing story maps for our work. And they're quite tricky to set up initially, but then they also can hold an awful lot of information. And so this is an ongoing process for us, and we're going to keep building our work into story maps. So just on the screenshot that you can see here, you can see 3 red dots, and those red dots reflect actual assets in the community. And then the box that has the text in it says increasing performing arts in Washington County. So Washington County, you know, applied to be our community for the year, and we got all these assets and all of these project ideas. And then we have to go to our faculty and say, which of these projects would fit into courses that you're teaching? So what's great about this is the faculty member interested in whether it's nonprofit management or they're in the performing arts themselves can look at these projects. And at the top of the map there, you can see the different sections: education, housing, employers, employment. And those are the different asset categories on the map. And so this one, I've happened to click into recreation, arts, and culture. And what's great about this project is it's really kind of broad, and it's about, like, how do we do this, you know, arts programming across Washington County? And then the 3 red dots are 3 different assets that are held within the community that are related to this project. So one is I know one is a little theater, and one is a community building, and another is an organization. And so this would give a faculty member the idea that they could do this work in any one of or all of those 3 locations. And so that also helps us to not preference, so that the middle dot is actually the county seat, and it's the largest of the 3 communities. And oftentimes our county seats get a lot of preference when we're doing work because they've got more facilities, they've got more assets. But our challenge is to work across the county. And so this just gives us a really good visual representation of keeping up with that as we go. I just also wondered, had any of you used story maps in your work too? Because like I said, this was a first go into this, and it was sort of an interesting, it was an interesting, I think it was a good first effort, but we certainly got a lot more to learn about it. So anyway, so Todd, do you want to?
Yeah, and what I'll say with this, when we send the slides out, we'll make sure that that link is active, so you'll be able to go into the story map and scroll through all the different assets.
Thanks, Todd. So I want to just give you, I want to frame out for you the ways in which we do our work. So if you can, yeah, we're on the next slide, great. So this is the first community that we worked in. We worked in a county just south of where we are here in Bloomington, Indiana. And in this was our first year, this was our pilot year doing this work. And both Jeannie and Whitney signed up to participate in this. And this is just, I just want to share with you just to contextualize the ways in which we work. These are Jeannie and Whitney's students. The photograph at the bottom is them doing their final presentation. And on either side of that photograph, you've got this What Moves You Mitchell, which was a part of what the students had put together. It was a trail map that indicated where you could go and take walks and around the town, and they were all signposted already. And so they utilized the assets that already existed in the community. The students went out into the community. It was quite a bracing day, as you can see from that photograph of Whitney's hair blowing in the breeze there. And they also, they went and they inventoried assets in the community. Now, it's important to note that in our first year, we had not yet sort of fully adapted or adopted the asset-based community development model. We were doing it without necessarily deliberately doing it, and there were pieces of it that we needed to do better. But the classes worked together, Whitney's biology class and Jeannie's kinesiology class. They took different approaches to looking at these issues around health, and the health educator in the community had said, hey, we're really concerned about the rates of obesity, and particularly obesity among young people in our community. And then we obviously have a large number of the population who have type 2 diabetes. And so how could we increase physical activity in the community? And that was the project idea that she had. It was as broad as that. And Whitney and Jeannie brought different disciplinary approaches to sort of addressing that problem with their students. And the students came up with different types of deliverables. But it was a great presentation, and the health educator herself said that she'd been left to her own devices to try to come up with this map and all the other things that the students had put together, including assessment tools. It would have taken her at least 18 months of work. And so she, as a grown woman, cried through the presentation because she was so enamored by what the students had put together. So I wanted to show you this just to situate in your minds what Jeannie and Whitney are going to be talking about next. And then I do want to talk a little bit, Todd, if you can move on one slide, about what I'm going to be working on in my initiative, what we're missing. And I know that we've done a great job with asset mapping, but we have not done any social network mapping yet. And so that's going to be the next thing that we move into, which is really going to be about how to do appropriate social network mapping and to utilize that to better understand the community. And then also, because obviously we're in a rural area, but we're working with college students who come primarily from urban and suburban areas, we need to add an element of education around rural competency. So cultural competency based on rural America. And rural America is different everywhere you go. Our version of it looks very different than what you might see if you went out to Big Sky Country and, ranches that are on thousands and thousands of acres. Our community looks different, but there are still things that are the same. The ways in which land is used, that population density is really low. Those are the things that we want to make sure the students understand, and that we also clue them in on how to look for the positive things in rural communities, rather than having a framework of assessing rural communities by comparison to how they're not like cities. And so Catherine and Whitney and Jeannie and another colleague and Todd and I are really kind of putting those pieces together right now for how to do a better job of really trying to both educate our faculty and our students to what's going on in our rural communities and how they can appreciate those things as they are working in partnership with our communities. So I would love to hear suggestions from any of you who use social network mapping and who have done some cultural competency work on what's worked really well for you. We'd really like to get that information from you. As whatever venue that takes place here in the chat box, or you send us an email because we really want to know how to make that work better. So, well, with that, my little section here on how we kind of use this in our course-based work is coming to a close. Catherine, did you want to mention anything that's come up in the chat box?
No, I think I appreciate what people have shared. Kay mentioned that story maps were really great, and there's a lot of potential for that.
Yeah.
It was also, I was curious to see what was happening with broadband in New Zealand. And about 80% of people, it sounds like, have broadband, but there's a push to expand it to everyone. But I would love to open it up if others want to share.
And I'll mention one thing as well, Catherine. I think we've noticed through the pandemic regarding COVID that the significant disparity between those who have and those who do not have reliable high-speed internet or broadband. And so, not that that's particularly in our wheelhouse, but we do recognize that there needs to be more work done with regarding digital inclusion. And so we're going to hopefully try to help regarding that, because rural Indiana, like a lot of rural places in the United States, don't have access. But getting back to the social network mapping, was there any questions or perspective that somebody would like to illuminate?
I find a little uncomfortable silence.
Adding on to what Todd said, I'm curious. So we think that it's really important to develop this rural cultural competency module. You know, some of you're not necessarily involved in the rural area, but do you use cultural competency modules in the communities that you work within? So what role does that play in, and does it help, or is it necessary, or is there any kind of framework that you use to impart the culture of the community that you're working in?
Dee, if I could ask you, since you are a global nomad, being around 20 different countries, which I find absolutely amazing and exciting. I take it in a lot of ways you had to work maybe differently in different countries or with different communities.
Yeah, and that's actually one thing I was about to say was I have seen so many different ways of doing it. Like a lot of the Asian countries will use, participatory action research and different but in the university setting, they'll use that for, student placements or engaging with the community. But I don't use any one in particular. So I'll kind of slot into whatever other people are using and add what strengths and skills I have to what they're already doing. So, very ABCD focused. So there's no one in particular I could say I use. The only thing that I can add to this conversation is on ABCD in Action, the community platform that anyone can join. There's a really fabulous conversation happening around asset mapping apps. And people who are creating them or trying things like Coggle or Personal Brain, or they're trying these different things, and there's beta type apps being used in India for people to log in where rubbish needs to be picked up. And so what else can we use that for? And so there's a lot of app stuff that's really starting to come to the surface. And I have seen social network mapping with others who are using it. And like I said, I just kind of slot into what they're doing and see how I can strengthen that.
Oh, that's fantastic. Anyone else? Any other comments or questions? It's a good song.
Yeah. I've been on mute forever, and then I get a call.
Oh, that was you. Awesome. I'd like that song. Any other questions or comments? If not, I guess we'll Jane, right? We're moving on to Whitney.
Yes, please. Thank you so much. I appreciate it.
All right, that's me. Sorry. That's the way it always works. It's like when I'm on a call, everything's good. And then as soon as it's my turn to talk, my dogs bark or my phone rings or something like that. I think I have my dogs under control right now. So Jane did, thank you, everybody. Thank you, team. I want to say that we have a wonderful team at IU, very supportive, and we have a lot of fun as well. So Jane did a good job of setting up some of what Whitney and I did, and Whitney is going to jump in anytime that she wants to add something to the conversation as well. our path began 3 years ago in Lawrence County, and before under the auspices of Sustaining Hoosier Communities. And it was before we were doing the ABCD mapping. And as Jane said, we basically we connected with Mitchell, which is a small town in southern Indiana, and they had identified a need for physical activity programs and ways to be physically active to try, and they had high rates of obesity as well as hypertension and cardiovascular diseases. So they were looking for us to come together with them and try to figure out ways that we could promote and educate the community regarding these issues and places where they could be physically active. Some of the partners that we had, as Jane mentioned earlier, the Purdue University Extension Service is kind of a regional thing that's in Indiana. It was a community champion. It was funded. Their interaction in this project was funded by an outside grant. Each of the regions also have health coalitions as well. So some of them are stronger than others, but they've all kind of come together, and those could include parks and recreations, faith-based organizations, tourism, chambers of commerce, different groups like that. So those were some of the community partners that we worked with. And essentially what we were trying to do, the work was, as Jane mentioned, my students were Masters of Public Health students and Whitney students were biology students. So we wanted to bring them together, their expertise and their perspectives together to try to develop assets that this community could use to increase physical activity and have an impact on chronic disease and you know, cardiovascular health. So we had to figure out before the ABCD, we had to figure out how we could work with the different community partners to leverage their assets to meet their needs. And so what I'm going to talk a little bit about is how we approach that. And then after I talk about Mitchell, Whitney's going to talk a little bit about what we're doing now in the next county. Todd, next slide, please. So what did we do? How did we approach things? So we had, you know, Jane had put together, you know, basically there was a list of different groups that were looking for help in different things. So these were problems that they had identified. So we went down there with the students. We had multiple meetings with community partners to understand their partnership. And Mitchell is the home of Gus Grissom, who was an astronaut. And one of the things that they wanted to do was try to create a trail in honor of him and capitalize on the state park that was very close and that history. So we went down and we made multiple visits to the community. We did walking tours. We went to the state park and saw the Gus Grissom museum that they had there. We went to Gus Grissom's home so that we could understand, you know, their values and where they were coming from. They had just begun creating a walking path in their community as a means to increase physical activity. And so we walked together as a group on the walking path with people in the community, with the person from the Purdue Extension, and we, as we walked, we noted different things that could be improved on. They took us to the places where they were doing, starting a community garden, and they talked about the things that were important to them and the things that they wanted to work on. So taking that walk was a kind of nice organic way to gain information and for the students to have a better idea of things that were important to the community. So that was one thing that we did. And then we had about 4 or 5 trips down there. Another thing that we did was we set up a focus group. And so this was a student-led focus group meeting. We organized it. We got, I think, 5 people from the faith-based communities. We thought that might be a good way to to address some, a variety of different people in the community. So we had faith-based organizations. We also had the Chamber of Commerce was there, and I think there was somebody from tourism. The students set up the focus group. They came up with the questions. They figured out how they were going to run it, how they were going to record the answers, and basically how they were going to report out what their what came out of that. And let's see, we also went down and we did an assessment of their community. So there's something called 880s. It was began by a gentleman. I can't remember his name. I think it was Gil, and he's in Canada. Perhaps some of you know that. Basically, where you have an assessment tool and you can go in, and the idea is that the community is a place where people from the age of 8 to 80 can be active. So my students had been trained in this, so they went in and they did an 880s assessment, looking at ways for that's right, that's correct. Thank you very much, Emily, for his name, which is in the chat box. So they went in there and they did this assessment and provided feedback to the community about ways that they could increase physical activity opportunities for everybody in the community. They also created that physical activity map that Jane showed that had all different places in the community that they could be active, as well as, oh, thank you, Jersey, as well as different runs that went on, the Persimmon Festival and the run that was occurring around that. They also, in the presentation they gave to the community worker, they also came up with PowerPoint tools that could be used, that members within the community could present to the community members to try to educate them on the benefits of physical activity and cardiovascular disease, etc. And lastly, but not leastly, we went down there, Whitney's students and my students came up completely on their own. They developed a health fair and they covered a variety. I think we had about 20 different stations. They covered a variety of different topics, and we put that health fair on one Saturday in April. Okay, I think I covered just about everything there. Next slide, Todd. I'm from New Jersey too, the Northeast, so I talk fast. I'm trying to slow down. What did our community connections look like, and what did they work like? So we as universities are traditionally in silos, and so I was very excited to work with Whitney on this, with her being in biology and me being in public health. There were other people working on projects down there in informatics, looking at ways to track activity and ways to get people outside. We made many different connections subsequently through the Center for Rural Engagement. And basically what we do is we bring as a university, we bring a range of assets to the community. And we want to develop assets that we can leave there, assets that they can use. Whitney is going to talk a little bit later on about some other collaborations that we're developing. Okay, next slide.
Do we want to? Sorry. Do we want to? Never mind. You're asking the question right now. There's a question in the last slide. Sorry.
That's okay. So basically, in small communities with limited capacity, the presence of our students and faculty can sometimes feel overwhelming. We'd love to hear, could be some chaos. We'd love to hear your suggestions about, how you can build and develop and sustain those relationships. So we felt like we made some pretty good connections with the faith base and hope that we left something that they could carry forward. But we wanted to hear if there were any ways that you've been successful in building and sustaining relationships. And Whitney, if I left anything out of, kind of talking about what we did in Mitchell, please chime in there.
I don't know who wrote in the chat bar, but whoever it was, can you talk a little bit about walk and shop? because I think that sounds like a pretty interesting program. I would just like to hear a little bit more about it.
Let's see.
Like Cheryl talked about it and said that she'd heard it in another workshop, and I wrote that I've done one in Chicago around the 6 assets of ABCD.
So is that, so why workshops? Do you mean walking and having a workshop at the same time?
Kind of. We did like it was in a school, and with what do you call it? You know, like the parents and citizens group. So it was them. We did like only 20-minute kind of glass half full, half empty thing. And here's the 6 assets of ABCD, and let's go walking around the neighborhood and see what we can find and identify. And it started to build relationships with neighbors really quickly because people started talking and asking what different things were. And they found a neighbor who said, I've noticed that your community garden in the school gets overgrown. Would you like me to look after that? And I'll do mowing and stuff on the weekends. And so they kind of came back after an hour of workshop with a whole lot of other connections and new initiatives and ideas, and it was really, really simple and really powerful.
That's great. Yeah, I think that's kind of the experience that our students had as well, and just walking around, and it just really gave them a feeling for the community and for different ways that they could contribute. And I did want to say about this experience, Jane talked a little bit about how the community health worker reacted. Well, the students had a really positive experience as well, and they gained so much out of working in the community and I think they're going to be taking a lot of that forward.
It was also mentioned in the chat that service learning was a really great way to get students involved. And Mandy made the excellent point that free food is also a great way to get students involved.
And service learning is essentially, it's kind of like what we do with our students, except that it is, there's a true focus on the whole community rather than an individual partners and projects. And so I would say that that's more, so we kind of think of the work, or we do use the term engaged learning rather than service learning when we're thinking about the work that our students are doing, because they are working in the entirety of the community, even though we then may be working more closely with one partner or another. The nature of the asset we're working with, the nature of the project we're working with connects to a community vision.
All right. So so I think basically, I think it's time now for me to hand this over to Whitney, and she can talk a little bit about now moving into the next phase. We're continuing on with trying to promote physical activity as a means to reduce chronic diseases. But now that the Center for Rural Engagement is up and running, and we have Jane doing the ABCD, we're taking all of that information and moving to the next step and building on things that we've learned to develop this physical activity network. So Whitney, I think you're up now.
So our work with our initial work was what we called before ABCD, and while the nature of the appreciative inquiry and building on community assets was a focus of the work, we didn't actually have that whole map and that visualization of the community, and so we had to kind of parse that together at that time through our colleagues and through the gatherings at the center and the connections that the center allowed for us to have on campus and off campus. And so I think what we really wanted to emphasize in our growth and our work over time is that this model, this asset-based community development model that we're using, really goes beyond just helping us understand communities and make those connections within and across communities, and that being the university community as well as the communities that we're working in. But it also helps to make those the assets visible, to make the communities visible, and provide for a collective understanding that builds a trusted relationship and partnership with our communities, and that it provides that framework and that collaborative framework that's so important when you have institutions of the size of Indiana University, and the breadth of different perspective and expertise that exists within the university community, and then also within the communities that we're working in. So the development of a more formalized procedure, or I call it as a scientist, but it's a way of really visioning, and this is that is jointly shared, and this I think is key, or we think is key to both allowing us to do our immediate work, but also to provide for a sustainable continuation of the work, and that for the future of the communities and the future of the collaborations. So that while our model for the teaching model is that we work very intensely with one particular county for a year, as Jane talked about, we don't sever our ties after that year is over and move away from that community, but rather this model allows for us to have a continued relationship that where again the community is always the driver. And so we from the work that we did in our first community, we identified, as Jeannie talked about, that there were assets that communities have, and that these we've begun through our asset-based community development model begin to see commonalities across the Uplands region. And so, for example, the physical environment, so that we have parks and we have trails that are in place. We have the different community organizations like the YMCA. We have also state assets. We have state parks and things of that nature. And so these physical environment assets, coupled with the identified health needs that have been put forth by the communities, such as a desire to increase physical activity and reduce chronic disease, that these have allowed for us to think about, well, what about building a network where not only are we working in collaboration with the communities, but the communities are working in collaboration with one another, and that we can begin to think about how they can share common resources, and that we can really build the strength in particular in this region we call the Uplands, but this could be across the whole state. And that's, I think, a vision that comes from implementing asset-based community development models in communities and making those visible. So Todd, if you could go to the next slide. We'll talk a little bit about what the Uplands Physical Activity Network vision is and how it is emerging through an understanding of these commonalities of assets and the commonalities of connections and communities. And that again, the assets are these outdoor spaces. And we learned from some projects that we did in other counties, Jeannie and myself, that there are partners that are even national partners that are in our state. Like we have a Hoosier National Forest. We have state parks, outdoor and other outdoor parks and spaces and communities that we can really help communities leverage to meet their aims and goals of health and well-being. And so these include, as Catherine talked about, the reduction of chronic disease, the involvement of youth, that there is a real desire to begin to address, especially, for example, childhood obesity, but to think about also family activities or whole family units involved in healthy living, and then mental health and the benefits of outdoor hiking and outdoor walking for not only physical well-being, but also mental well-being. So the Uplands Physical Activity Network stemmed from our understanding that our work in Mitchell, and then also talking with different health coalitions, talking in communities, the visualization offered by ABCD, and then most recently, the Community Health Action Team that was put into place in Washington County, the county that we are going to be working in intensively this coming year as part of our Teaching and Sustaining Hoosier Communities model. So if you could move to the next slide, Todd. So the this just kind of reiterates the points of assets, thinking about community identified enhancements, and then growing a network that not only includes the assets that are in that community, but also there are other stakeholders that are that you can bring in that can strengthen that and can strengthen, in our case, the Uplands Physical Activity Network. So at the state level, we have state health departments and parks and tourism offices that we can bring in to help motivate and promote and engage our communities, and also begin to build those models that extend beyond individual communities and therefore connect communities, but also allow for common resource sharing. And so, for example, the one thing that we might think about is how do we gain recognition for building or identifying trails in a community, and how do we allow for individuals to have some sense of achievement when they are reaching specific physical activity goals, and how can these then motivate communities? Or maybe we could create a little competition between communities. And so we're thinking about different tools that we could engage our Parks and Tourism office in that might be able to provide that recognition to individuals and recognition to communities for their efforts to increase park access, to increase the number of individuals who are participating in hiking, or individuals that are participating in any type of physical activity. And that these are then going to again, work to make things more visible and to enhance a region as well as individual community, and build relationships for communities with entities that are stakeholders that may not be immediately apparent to them. So I'm moving to the next slide. So one question that we have is that we think of communities, they're dynamic, they're always changing, and they have new individuals that are coming in and out. And that's true both of our university community as well as the communities that we're working with. And so you develop these models, and you and an understanding and these trusted relationships. But how do you bring new people, continually bringing new people in, and who are not familiar with your appreciative inquiry and your ABCD model into your network and your ways of working in community? And which is something that is essential to being able to continue the work and move it forward and keep it inclusive. So that's a question that we're putting out to the group, that how do you continue to bring people in who are not necessarily familiar with these types of models and ways of working?
Jeannie, I think you had some great feedback. I don't know if you want to discuss. I'm not familiar with the photo voci. You want to share that?
Okay, yeah, I'm a horrible typer. I should say photo voice. So the question was other than looking at the health parameters, how do we judge what impact we have on communities? And I think that, you obviously have to go back to the communities to ask that. Jane had mentioned that they do follow-up surveys with students and faculty as well as the community members to see how things went, on the projects that they were working with. But I think going back into the community and doing subsequent focus groups, or also we're thinking about things like digital storytelling. So when you interview someone, you might just interview a couple of different community members and have them talk about in their own words the impact that it had. Those can be incredibly powerful. And photo voices is another thing where basically you give cameras or ask people, community members, to take pictures of a particular thing. And that also is them basically taking what they're seeing and what they're feeling and communicating it out to the people that have worked, and kind of really getting an idea of what the impact was. I apologize for the misspelling.
I corrected it for you, Jeannie. I put the link into Photo Voice.
See, that's what I mean. We have a great team.
Go team.
No judgment here.
Hey, this is our last slide, and so again, we'll email this packet out to everyone. I'm going to stop sharing the screen, and we can open it up for about 15-20 minutes, and we'd be happy to try to entertain any questions, or just if you want to chime in with perspective or ideas, we'd love to hear about it.
I mean, we'd just be happy to entertain, really. Period.
That's what we do.
That is what we do.
Danielle mentioned she would recommend just keeping the language as simple as possible to make sure that everyone feels comfortable joining in the conversation, which I think is a great point.
Okay. Very true.
Any questions or perspective?
I have a question about, a couple times you mentioned, different people have mentioned, kind of there was this moment where ABCD influenced your work, and kind of a before and after. I'd be curious to learn more of what that looked like in terms of technical assistance and things like that. And was it an aha piece, or was it a gradual progression, or what did that look like?
I'm happy to, thanks for that question, Alison. I'm happy to talk about that. as we started doing this work with sustaining Hoosier communities, that actually predated the work of our Center for Rural Engagement. And so I had about 2 years of work under my belt before the Center for Rural Engagement got started. And my position was, and the program was moved into our Center for Rural Engagement, which was a really good fit and a great home for us. And it sort of just seamlessly coincided that as I was still trying to really get my feet under me in this process of doing outreach with communities, the ways in which we wanted to do it, I just started reading a lot more stuff. Whitney has a lot of experience in community engaged work as well. And so she and I would sit and have these ostensibly hour-long meetings that would run for maybe 3 hours, in which we really just talked about all the ways in which we could investigate different theoretical frameworks to pursue our work. And the more I dove into some of those things, the more obvious it became that we were, without really knowing it, we were using this asset-based community development model. And if it was the model we thought was the best fit for us, which I believed it is the best fit for our work, what would I need to strengthen in the way I do my programming so that it would fully support our embracing the asset-based community development model? And so my work then in some ways became an exemplar for our center, for how all of our center work could sort of move forward, and really embracing the community first piece of that became a really important, the most important thing, I think, of the ways in which we conceive of the work that we do. So we don't come up with an idea and then try to find a community to shove it into or fit it into, but we come up with information from communities and find ways in which we can respond in an appropriate manner. So I think there was a sort of aha moment, but it was more of an evolution, I think, perhaps, rather than just one day like it kind of struck us. But the model itself has been really helpful for really understanding how to frame the work, and then to understand the pieces that are missing from the ways in which we do our work and want to do our work better in the future. So that would be my response. Maybe Whitney might have some other things to add to that.
Build on the idea that faculty often they have their research, they have their teaching that they're doing, and so they take that and they want to take it to community. And so helping them to, which is wonderful, but in this model, it's community driven. And so that was what we really want to communicate, and we want to change that culture for faculty and students to understand that they are not taking their ideas and imposing them on community, but rather we're listening to community and building on the assets that the community has identified in the projects and goals and future that they have envisioned. And so that's what I think this model really, we were seeking is an opportunity to, how do we communicate community first, community driven, community ideas that faculty can then say, oh, I see how my research fits with that identified community project, need, or asset.
We have a couple of good questions in the chat. Emily posed the question, I'm wondering if folks have tips for engaging and forming relationships with new partners during COVID. Does anyone have ideas for the next best thing to in-person meetings when we aren't able to gather large or even small groups? And I could definitely use some advice.
Yeah, I think we all could, for sure.
Yeah. Any thoughts from people about what's working for you, what's not working for you?
I think that the context is different, right? So if you already have established relationships, it's much easier to continue your work remotely. If you've built some kind of trusting relationship, I'm not sure how, we're really struggling with this right now. October would be the time that we would reach out to a new community and seek applications. And September and October, we will start working with potential new communities so that they can be ready to build their application. And that really kind of Zoom meetings are no substitute for being present in the community, actually showing up, and that's part of how you build trust. And I really struggle with how we're going to be able to do that in a way that feels honest and robust. So yeah, I want to hear what people have to say too, because it works just fine with the community partners that we already have, and texts and emails and phone calls work great, but I don't know how you build that remotely. I struggle with it.
So he did it again. It's where that's my boy, Jersey boy. Every time I open my mouth, he says, no. So I see a question about from Emily about creating a physical activity. She's in charge of creating a physical activity strategy for her town and struggling with how to create an accessible engagement process. And that's absolutely, I mean, that's some of the things we were just talking about is, Zoom appropriate, different ways. One of the things that I think would be useful is, and a good starting place for any town, and what we did with Mitchell was, you can find out what their assets are just by searching on things and things that they may not have even thought of, So we're looking at really promoting outdoor activity, and there's been an uptick in outdoor activity with COVID. I mean, people are really jumping on that. So just go online and look to see what you can find, what maps are available, what trails are available, and start kind of that way. What facilities are available for people to be active in. Another thing that this Mitchell community talked to us about was a shared use agreement. So finding like schools or churches is what we thought, where you could potentially have times when the community can share that. So I think we certainly want to gather information from the community, but it also is extremely helpful if you gather information on your own as best you can, so that you can go in and basically say, hey, these are some of the things that I saw that are assets. Are you aware of this? Who should I contact about this? How does your community feel about using these things? How can I help promote physical activity using the resources that you have? So I think gaining an idea of resources might be a good place to start.
Yeah, I'll add on that too, Jeannie. I think Danielle asked a question earlier about how do you measure, or what about community vitality and community trust? I think one thing also that we recognize with this project, which is really focused around health, but our two other focus areas of community resilience regarding food and water and recreational assets, and also quality of place, is tying in potentially opportunity for exposure or knowledge of farmer markets or community supported agriculture, where to access local grown food, but also maybe in addition to going to parks and trails, visiting murals or, public art festivals, whatever the case is. So make this more comprehensive, where it does develop community vitality, and I think enhances community trust. And so that's some things that we're thinking about as well.
Useful.
I know that some folks have been, even our communities, we're looking at the 4th of July and Independence Day celebrations, and many of our communities have long-standing 4th of July celebrations that it takes them months and months and months to work on, and they're having to cancel them, and they're trying to figure out how do they maintain that sense of community and move a sense of, essentially an immovable holiday. How do you then move it to maybe October or November, maybe when things look a little different. So communities are really struggling with some of these things too, that it's really, it's interfering with some of their traditions. We do know though that some things work much better for us. So we've been holding workshops on creative writing for kids, and also creative writing for community partners of all ages. And when we were hosting those in person at local libraries, we would get like 6 to 12 people showing up. And we just hosted a series of creative writing workshops. We hosted them all online, and we had over 100 participants in each of them. So we recognized that in some ways, moving things online actually increases participation, and in some ways, it affects our ability to build relationships. But I think even relying on networks that exist in the communities. That's something that we've done this year as well, where we provided additional services to communities by helping them build websites around COVID, resources that they might need. But we didn't do it by just kind of creating something whole cloth and sort of tossing it out there, but we built on the existing networks that existed in the communities. Everybody seems to have a Facebook page for their community, whether it's a good or a bad thing. Usually it's the place where everybody goes to complain about stuff. But, tapping into those has been really helpful in us, kind of maintaining our presence and maintaining a sense of, contributing to communities as well. So I do think there are ways. I'm just not necessarily the world's most creative person to come up with, how do you convert a physical activity thing to an online thing. But I think there are ways of doing online check-ins and, is mailing people things instead of like giving them something in person, but like a sort of like carrot and stick, like reward process. So I'm not sure. I think there are ways of doing it, but it's tough. It surely is a tough time right now.
I love those ideas, Jane. And so just because we've lost a couple people, I wondered if we could do our group screenshot right now. So if everyone can smile.
Can you, if you would, if it's okay, to show your video if anybody's interested, so we can see your face. If not, then you can leave it muted, and that's okay and understandable.
All right, 1, 2, 3, cheese.
Cheese.
Beautiful, great.
Nice.
And Cheryl asked, Cheryl asked a question a little bit ago that I want to make sure the answer, and that is, how do we, any thoughts on using our methods and lessons in urban settings as well?
Yeah, I don't know that our model, I think our model is transferable to many locations. The EPIC network that Sustaining Hoosier Communities belongs to works equally in cities, in small communities, and then we are the largest sort of rural-based program. But the ways in which we engage, I think are the same. It's about building a network. It's about figuring out who's in the network and then expanding the network outwards. So yeah, I don't know that it, I think the model applies just about everywhere. And I would suggest that, digging into those networks is always the first place to start to build that rapport. The first thing we do in every community is that we require the community to come up with a community coordinating committee. Thought it was really, really fun when I invented that name to have an alliterative name, but now I have to say like community coordinating committee. I'm realizing that was a really big mistake on my part. I should have come up with a simpler name. But that coordinating committee is our eyes and ears on the ground in the community, and we rely on them, and we delegate a lot of work to that committee. So if we need to know like who's the right person to talk to, well, I'm not going to be able to figure that out. But if that coordinating committee is broad enough and represents geographically the area that we work in really well, and also have representation from all ages and stages of life, then we ought to be able to, build a robust network in the community. And I think making sure that whatever community you're working in, that you have that representation in the community that's genuine and trusting. I mean, I can text my community coordinating committee lead and she'll respond to me in 5 minutes. So, I think building that up in a community is like the most essential sort of first step.
Great. Thanks, Jane. Oh, and our picture is so great, just to like.
Verona, I'd be happy to talk to you about what we did. I'll send you my email address here.
Okay, definitely.
You can be pleased to talk with me about it.
Any other comments or questions? One thing that we did realize with the Upland Physical Activity Network was, which I think originally the ideas started, as Whitney mentioned, around physical well-being and trying to reduce lifestyle diseases such as obesity and hypertension. But definitely COVID has hit the United States significantly, like it has in many other countries. And so the suicide rates are actually up in the United States. And so mental health, especially in rural communities, there's a disparity of access to mental health. And so getting out and exercising, research shows that's also good for mental well-being. And so that's something that we think is incredibly important about this, this project as well.
Mm-hmm. Yeah.
Oh, I saw the question from, or the comment from Colin, and I think that the idea of creating challenges and motivational type of tools like that is a great idea, and we've seen that in some of our communities. And also it's some way of credentialing people's efforts, I think makes a really big difference, and also allowing for that to be visible, whether it's through social media, through a web page, or other way of recognition in a community of achievement. I think it goes a long way to getting more and more people involved.
Yeah, it was great that we have a community partner who had a program called Ways of Wellness. And if you signed up for Ways of Wellness, you got a t-shirt. Now, this is a small community of about 6,000 people. And so you can imagine if you wore your t-shirts, people were going to see you wearing it. So you got a Ways of Wellness t-shirt. So just said, wow, on the front, Ways of Wellness, right? And then every time there were four total challenges, I think. And every time you completed a challenge, you got a star in the mail, which was an iron-on like a patch, and you could just iron it onto your t-shirt. So then when you finished, you became like a 4-star general. And then I think there was like, I think if you completed all 5 steps, they gave you something else. So you got stars for all of the steps that you completed. And if you completed the entire process and did something extra, there was some other big patch that made you, I don't know, Todd would have to tell us what comes after a 4-star general, like chief of staff or something, I don't know.
Yeah, good job.
But that was a really simple way for the community at a time when, they didn't have as many people doing social media. It was a really easy time, a very positive way for them to get the word out about Ways of Wellness. And people were encouraged to wear their t-shirts when they were out in community or when they were exercising. So, yeah.
Another idea that has had success is not only this kind of competition or sticker or badging or credentialing your effort, but also we have like a walk with a doc, so that getting your healthcare providers in the community out there with the community has been had a great deal of success. So that it's just like every Thursday night for an hour, we walk on some designated trail, and we have a different doc, or sometimes maybe it's the same doc, so that you get to kind of hang out. And these days that might be a really helpful thing too, as people have lots of questions about how to navigate health and well-being in a time of COVID.
Mm-hmm.
Well, the final question that I imagine you're getting in all of your sessions, because I think it's the same for all of the sessions, is just asking, what are you taking away from this session that you'll share with others as a result of attending? So we open that up to anybody, and then Kim, I think we pass it back to you, correct?
I think the concept of rural competency, I have one foot in a health equity world, projects and programs. So as much as I work in a rural area, I haven't thought about it in those terms. So that's something I was Googling as we talked. So that was helpful to think about.
Well, Allison, we'd love to stay connected with you. Jeannie, Jane, and Whitney and I are working on that. And so we'd be happy to share information and perspective on ways that we think we're going to try to work through and accomplish that.
And I would also put a plug in that the ABCD Institute does have a rural work group that meets on a regular basis that I can share that information. For
That would be
anyone that's-
great. Thank
Oh,
you.
thank you.
Yeah.
And I also wanted to say this would be really interesting for the ABCD Institute also has a higher ed work group that's working on.
We're just hitting all the work groups.
Yeah, you guys are, this is so interesting. So they're working on trying to, just gather curriculum for Campus Compact, ABCD and higher ed. And if any of you are interested in joining that group, I can share information.
Yeah,
Sign me up.
please, Kim, please do. I also contacted ABC Institute and said we could be a test pilot, Indiana University, if they were looking for such. We'd be happy to, and we're relatively close as well.
Right.
Plus we do ABCD. So,
Yep.
so
Definitely.
yeah, if you would share that, that'd be fantastic.
Oh, okay. That's great. Yeah. This has been really interesting. Thank you.
Any other closing comments?
Just a couple of new terminology that you all use that I really liked. The digital inclusion, as opposed to talking about what people don't have, the goal of helping people have what they need. And engaged learning, engaged learning versus service learning.
Yeah.
Frame on that. Really helpful.
Thanks, Cheryl. That's been a big one for us to learn too.
Yeah.
So Cheryl, I have to say, I just learned about digital inclusion. And so that comprises 3 pillars or 3 tenets. And so that's infrastructure, the internet service providers. It also is, so that's the first pillar. Second pillar is equipment. And the third one is workforce development or educational attainment. And so those are the 3 pillars that from my understanding, the research and the talk around digital inclusion. And so trying to work on developing digital inclusion task force at the county level in rural Indiana to bring key stakeholders together to talk about those 3 areas. Because my understanding is if it's focused just about internet providers, there's so much left out of the conversation that you're almost sometimes at the whim of money or what the internet providers want to do. And so this makes the conversation a little bit bigger because it's threefold components.
Okay. Thank you. Thank you.
Absolutely.
Really helpful. Thanks. I really enjoyed this.
Thanks.
Cool. Any other closing comments? Well, hey, I just got to say, I thoroughly enjoyed this and I really appreciate the opportunity. I work with a great team and it was great to connect with everybody across the globe, to feel everybody's enthusiasm and perspective and interest and wanting to hear some of the things we were talking about. Really appreciate it.
Well, thank you.
So good luck with the rest of your days and/or go to bed and/or good luck staying up late.
Thank you all for attending.
Thank you.
Thank you. It's really
you.
Bye,
interesting.
everybody.
Bye-bye. Thank you.
Thank you.
Hey, Todd.
Hey, are we still recording?
We are. I will stop the recording. Thank you.